Hello, we are Team Theralief presenting our product, Theralief. Our slogan is stress relief made easy. Hi, we are Team Theralief from Young Women's Leadership Academy in Fort Worth, Texas. We are a group consisting of 4 young women in the 10th grade. For this competition, we decided to use our knowledge of STEM to solve a problem we are passionate about. Our team member roles are me as project manager, Dominique Sinet, Peggy Carr as project coordinator, Karina Gutierrez as research manager, and Maria Dompieta as creative design lead. For our design process, we decided to utilize the engineering design process to effectively coordinate making our project. We defined our problem, generated concepts, selected a solution, made a prototype, evaluated, and tested our product. During the past 2 years, the coronavirus pandemic has outstandingly influenced the lives of many young people. With new policies being implemented, such as social distancing and virtual school, many teenagers were isolated and feeling alone. Now it is 2022 and teenagers are going back to school. This results in many teenagers experiencing overwhelming amounts of stress and anxiety. We decided to crowdsource data to help develop our product by surveying students within our school. Here is the data we acquired from crowdsourcing. So we noticed the peak in stress levels for high schoolers at level 8. That made a total of 16 stressed high schoolers. We decided to use this data to focus what we wanted our product to solve.
Our material list included a heart rate sensor, which would cost $6 and is used to sense the heartbeat, the user's heartbeat, and send a message to the wristband. A silicone band, which would cost $11 and is easy to have on and carry, and will serve as the main body of our product. 2 LEDs, which would cost $2 and indicate what your stress level is. A transmitter and receiver, which would cost $5 and send stress levels from the wristband to your phone to give stress relief recommendations based on your stress level. A chip compiler, which would cost $50 and will allow us to program the watch and send a message to your phone detailing video recommendations. A temperature sensor, which would cost $12 and will see your electrodermal ratings and will accurately display your stress levels. The total cost would be $86. But since the budget was $50, due to our original materials list being over budget, we decided to create a digital model of our project to explain its purpose. However, in order to also have a more functional demonstration of Theralief's abilities, we will also be using an Apple Watch to show its functions. So this is our digital model. Theralief is worn on the wrist in order to detect any increase in heart rate or sweat production. If there is a notable change in heart rate or sweat production, Theralief's LED light will change from green to red in order to notify the user and let them know that a meditation video will be sent to their phone. The user will then complete the meditation videos from Theralief until the LED light changes back to green. By utilizing heart rate and electrodermal sensors, Theralief will be able to detect when a user is stressed. When the change is noticed, our databases will search the web for a meditation video or breathing exercise appropriate for lowering the user's stress levels. Finally, the video or breathing exercise will be sent to the user's mobile device via text.
So here's our prototype data. In this graph, you can see that there's a change in the heart rate and the sweat production, which will be indicated on the watch that you're wearing, and will show a red light when it will send you a message. After designing our product to detect heart rate and electrodermal activity, we decided to simulate what it would be like if we were able to test a prototype of Theralief. We used the Apple Watch to run our test, which will be shown in the next slide. The watch detected when the user's heartbeat began to rise and when they began to sweat. When it detected those things, the screen turned red and it sent a text message to her phone with links to meditation videos and breathing exercises. Once watching the meditation and calming breathing videos, we noticed that the heart rate and electrodermal activity had gone down. Now here is a video of the Apple Watch being used. Okay, never mind. Okay, so the video was shown of Dominique wearing her Apple Watch, and when her heartbeat began to rise, the screen turned red, and her phone was sent a text message of calming videos and breathing exercises that she could use, since unfortunately we couldn't show the video. In conclusion, our team began to identify a problem we were passionate about solving. We decided on making a watch that can detect stress levels by using your heart rate and electrodermal activity. We combined our passion for engineering and programming to create a gadget that detected stress. We began by researching different heart rate monitors and electrodermal monitors and silicone bands and picking the most reliable. We also looked through meditation videos and calming exercises to see which would benefit our users. Once we chose our materials, we created a PowerPoint, our watch, and talked to Mr. Sir, our expert in programming. And in the end, we used our skills in engineering to finish our gadget and practice our presentation.
On February 1st, 2022, we received a generous donation from Dominique Sinet, our project manager. She was able to donate her Apple Watch waiting for our supplies to arrive from Amazon. The Apple Watch will act as our watch and will detect the heart rate of the person wearing it and will send a link to their phone with meditation videos. Our first expert is Mr. Moling. He attended Tarrant County College and the University of Texas at Arlington, where he earned his associate degree in business. He is a systems engineer IT manager for Lockheed Martin, and has over 27 years of experience in software development and IT experience. And so we communicated with him on January 30th, 2022. And the questions that we asked were, what device would we need to help program or send a signal to our heart rate monitor from our app? And number two, are there any programs you would suggest we use to create this app? And so in conclusion, Mr. Moling suggested we use a heart rate monitor, a small processor, an Arduino-based board to send data, Bluetooth, Wi-Fi, or a cell app that takes on the data and alerts the user. Our second expert is Mr. Carr. His background consists in engineering with a bachelor's degree in civil engineering from Prairie View A&M. He has 15 plus years of experience in the field of engineering, and we communicated with him on January 31st, 2021. One question that we asked was, what differences could we make in the watch to make it more effective for different types of mental health? And then our second question was, what materials are best or should be added to our watch to make it more effective? And in conclusion, Mr. Carr suggested that we determine exactly what mental health illnesses we are aiming for and to accommodate to that specifically. And then for anxiety, for example, would need to be programmed to look for heart rate, oxygen levels, and location. And since it's for anxiety, we would want an app that could have relaxing music and breathing exercises. This is our work. And so the research we gathered from online sources helped us to understand how stress can affect your heart rate and electrodermal activity. We came up with a solution that could track your heart rate and electrodermal activity and relieve your stress. And a special thank you to Mrs. Price, our teacher lead, Mr. Sir and Mr. Carr, our experts, and the YWPN donors. Thank you.